about some of the details, some of the frequently asked questions about Brazilian butt lifts. So Brazilian butt lift is where we do liposuction, usually 360, so including the abdomen, the flanks, and the back to really get that kind of broadened, snatched look. And then we transfer that fat to your buttock and hip area. And so what we do is we inject tumescent fluid in through all these areas. We suction all the fat out, bring it into sterile canisters, process that fat, and then inject it back into the buttock. And so we want to make sure to do this procedure in the safest way. So we will only be injecting fat into the subcutaneous tissues, meaning the fatty layer. We don't inject any of the fat deep into the muscle because that's where all those big vessels live. So we want to make sure that we're not injecting fat into those deeper structures. We then inject it to the hip area and the buttock area. We like to get a good idea of what type of shape you're looking for, whether you want a curvier shape, whether you want more of a bubble butt shape, and then we try to tailor the procedure to you. So I'm gonna come in, talk to you a little bit about your medical problems, any medications that you're on, what you do for a living, just to get an idea of what your post-operative care is gonna be like, whether you've had babies, whether you may have some extra skin, and then we're going to get you changed into a gown. I will come back in and examine you, and then we'll go over the details from there. So with a BBL, a lot of people ask me about scars, incisions, all that kind of stuff. So where we put our incisions, is you usually have one at the top of your belly button, two in your groin area. Every once in a while, we'll have to put one kind of up into your breast area right here. And on the back, we put it right in your bra line along the back. And then two in kind of the upper part of your buttock, one in the middle part of your buttock, and then two right underneath. So we try to keep them nice and hidden. All the incisions are about the size of my pinky fingernail, and they heal over time. Every once in a while, I will have to snake a drain in that can make it just a tiny bit larger, but again, we're talking about maybe now the size of my index finger nail as far as the incisions are concerned. Those incisions will heal over time, and most to the point where you can hardly even tell that they're there. So after I come in and examine you for a BBL, I will find out how much fat you have, whether you have some extra skin or anything like that, and then we'll take some photos. I'll then let you change, and I'll come back in with those photos using TouchMD to kind of show you an idea of what I think that we can achieve, what limitations we may have, point out some asymmetries because everyone has them and you're going to have them post-op too. And so just getting you prepared for what you can